Hello, we are from Student Group Discussion B3, Huliana Medical School. We are going to present about innovative program for developing empathy among medical students.
Okay, my name is Violina with student ID number 2002511083. So the first thing is the background. As medical professional, there are some requirements for the professionals to understand patients' feelings, opinions, experiences are also known as empathy skills. Empathy skills are important for medical professionals since it could cause huge changes in health providing, such as increasing patient satisfaction, increased healthcare practitioner well-being, reducing healthcare practitioner stress or burnout, even diminishing risk of medical legal. Some studies also show that empathy skills could lead to cost saving significantly and reducing patient stress. Empathy skills also included in standard professional conduct, which is base values that medical professionals had to have. Developing empathy skills in medical students have become an urgency. So this program is designed to hopefully develop students' empathy skills. For that purpose, so there are some objectives and benefits in a student project. For the objectives first, the first one is explain the importance of empathy skills in medical professionalism. Second one is explain how empathy skills positively affect the medical treatment of patients. And the third one, introducing an innovative program that hopefully could develop medical students' empathy skills. And there are some benefits like raise awareness of the lack of empathy skills in medical professional environments that are influenced by several factors. Second one, hopefully, this innovative program could increase medical students' empathy skills that could be applied in further time.
Hello, my name is Nadya Zalfa Aqilah with student identification number 20025111079. And in this occasion, I would like to explain about empathy. So, empathy is the tendency to attempt as far as possible in order to understand and share a person's feelings, situation, and perspective. Also, recognizing the difficulties by placing oneself in other shoes. This individual who has empathy with the capacity of imagining a particular situation becomes aware of potential consequences of that action on other individuals, and that therefore makes him capable of more responsibility. Taking others into consideration and pondering on their emotion and opinion is a crucial part of the process of the empathy. Thank you.
Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Now we will going to talk about the development of empathy. First of all, try to remember what is empathy. Empathy is a multidimensional concept with a cognitive and emotional component that can be defined as an emotional response to another person's feeling. Empathy may change as a result of cognitive and emotional development that occurs during human development. Many theories discuss about the development of empathy. One of them is Hoffman in 1982. This was influenced by cognitive theories of development and building on that suggested that empathy with cognitive-based function. The development of empathy can be seen as the following route from emotional to cognitive control, from intuitive and automatic response to more complex response that are associated with individual factors. Several studies that suggested that empathy is closely related to age. According to Hoffman theory before, we are born with the basic ability to perceive other people but lack the ability to distinguish between self and others. In early stage, children reach the veridical empathic distress stage between the second and third years of life, where they can empathize with others even they are not physically present. A study of 14 to 17 adolescents, self-reported is one of the measurements of empathy, found that empathy concern in this age was highly stable than in children in early stage, substantially more than perspective taking.
My name is Gusti Ayu Ika Frangipani Vedanti. My student identification number is 20025111064. As mentioned before, we need to develop empathic skills. There are many factors that facilitate its development. The first one is gender. Many studies reported that women show higher levels of empathy statistically than men, and women it shows a higher amount of empathic traits compared to men. In addition, women are more highly imaginative, which helps her to identify herself with other people. However, some studies show that there are no difference between women and men. This may be due to the sample use, and some professions that are basically helping by direct contact with people, whether women or men, are more likely to have a greater level of empathy. The second one, personality traits. These strongly contribute with both cognitive and affective empathy. Personality traits are classified into extraversion, agreeableness, openness to experience, conscientiousness, and neuroticism. The third one is parents, siblings, and family dynamics. A positive family environments, which characterized by attractive parenting style. When a child is surrounded by supportive family, gets warm, responsive, and open communication practice are associated with his empathic response. Wider family dynamics are also associated with empathy. The last one is neighborhoods and cultural background. Neighborhood, cohesion and control, quality of interaction, community connectedness, social support were all associated with empathy. In addition, someone who came from multi-ethnic background tend to show higher levels of empathy.
Hello, my name is Tyas Wirawan, and my student ID number is 20025111082, and I would like to present about the methods of measuring empathy. There are three main categories in measuring empathy, and the first one is self-report instrument, such as the Haugen's empathy scale that consists of 64 postal items, and it was considered as a reliable empathy cognitive measure. And the two methods are the most commonly used empathy measurement. They are interpersonal activity index that consists of 38 items that includes four-dimensional aspect to measure affective and cognitive component of empathy. And the second most commonly used empathy measurer is the empathy quotient that consists of 40 empathy items and 20 control items that is used to measure both affective and cognitive component of empathy. The second category in measuring empathy are the behavioral observational methods that evaluate individuals' response on experimental stimuli after watching image, video clips, or the other media. For instance, the comic strip task that use 2 to 3 comic strips to be chosen by the participant, or the picture viewing programs that allows the participant to view image in random emotion in a short duration, and to make a rating that will be evaluated. The other methods are picture story stimuli and kids' empathic development skill. And the last category in measuring empathy is the neuroscientific approach, which its development had a great influence these days since 1990s. This approach uses various medical techniques such as MRI, EEG, FEMG, and many more. Each technique measures a specific part of internal structure, including the central nervous system, facial expression related to the muscle contraction, and even electrical activity that produced by the firing of neurons in the skull.
Hello everybody, my name is Putu Yoga and my student identification number is 20025111084. So in this opportunity, I would like to explain the status quo or the current condition of ideas originator. So we can see in the table of 2.1, the compilations of 5 journals that measures the empathy level of medical students in universities of Indonesia. So if we calculate the average percentage of each empathy level, we will get 53.75% of medical students with high empathy and 46.25% of medical students with low empathy. If we analyze, the main percentage of each empathy level is nearly balanced, or in other words, the percentage of students with high empathy is slightly higher than students with low empathy. So, we can conclude that these empathy skills of medical students must continue to be developed so the percentage of students with high empathy are more dominating. So the question is, when is the best time for developing empathy skill? So it is advisable to develop earlier in the first year of medical curriculum.
Hello, my name is Gede Ngurah with student ID number 225111061. In this presentation, I'll cover about Chapter 2.6, Existing Program that Increase Empathy, Part 1, Empathy Assessment Program for Medical Student. So, the Empathy Enhancement Program for Medical Student, is known as EEPMS, is a 5-week program that seeks to boost medical student empathy capacity. The program aims to enhance the empathic skill of medical students through 5 consecutive weekly sessions of extracurricular small groups, which are conducted through peer discussion, lecture, and role-playing, along with real-time feed in order to ensure effective empathic communication in different situations in daily life. This program was measured with empathic quality chart, Jefferson empathic scaling, and emotional expressivity scale. The result of this program, the pedagogical impact of EPMS indicated that EPMS could teach medical students to incorporate emotional expressivity as an integral part to empathic communication. The limitation of this existing program, that first, EPMS only examined the measurement before and after the training. Second, analysis was made of both relation between nodes, while positive and negative relation between the nodes may have no different consequences and contribute to different perception. And the last, because of lack of previous research using the network-based approach to analyze the training effect for the conceptual incorporation of empathic communication, the researchers could not quantify the size sample required for this network-based analysis. So that is all from my presentation. Thank you.
Hello, my name is Satria and my student identification number is 2002511071. So, the next existing programs to increase empathy among medical students is the Virtual Human Communication Simulation. So, what is Virtual Human Communication Simulation? It is a type of software that has been created to educate healthcare professionals in empathic contact, particularly with patients and in interprofessional environments. It is called Empathic VR, which is a virtual human-based simulation. The simulation is designed such that it allows learners to have authentic, challenging interactions with virtual humans, or VHs, by using active learning strategies. Intelligent VHs can detect body motion, facial gestures, and voice in the simulation. Students are then asked to write qualitative reflection on their experiences after finishing the intervention. In addition, in 1 or 2 weeks later, students took an objective standardized clinical examination. The primary outcome of the trial demonstrated that empathic VR has a positive, statistically meaningful impact on medical students' proficiency in reporting a new cancer diagnosis and performing dispute mediation in an interpersonal scenario with the nurse. So next is the results. The qualitative research showed that 3 main positive trends for the empathic VR community learners are acquiring valuable communication skills, being mindful of nonverbal skills in addition to verbal skills, and feeling inspired to learn more about communication. But there are also limitations to these programs, such that a further research into training nonverbal communication skills in VR simulation is needed or warranted. Furthermore, the nonverbal behaviors are explicitly chosen for this simulation. Nodding, laughing, and eyebrow lifts are only a handful of the numerous nonverbal and verbal behaviors associated with empathic speech.
Hello everyone, my name is Chintami Masella and my student ID number is 2002511070. And today I'd like to tell you about the program overview. Based on the status quo that highly presented during the life of medical students, the program should be conducted in a few events. In order to emphasize the empathy of each medical student, we presented a program called For Compassio Vera, which divided in a 4 stages of fire: Formido, Intima, Reneo, and Explicatio. First up, Formido. Formido means an event where the medical students will be brought together by their biggest fear that has been gathered during the survey. Secondly, Intima. Intima provides the medical students to evaluate their hearts thoroughly by confessing their experiences anonymously. The third, Renew. Renew is an activity of collecting the lessons they had during the previous stages by presenting a basic case and situations where empathy involved. The medical students should be aware of the selected answer. The last is Explicatio. The last part of For Compassio Forac is a huge conference where the unverbal theory and answer will be presented by an expert. Objectives of the program. For Compassio Forac aims to stimulate empathy in medical students by undergoing brand new and creative steps related to the current global situation. The benefits of the program are presenting an innovation in the world of health related to developing empathy in medical students. Second, serves as a forum for the aspirations of medical students in conveying ideas and management of problem solving. And the last but not the least, raises a glimmer of hope for the development of communication relationships between clinicians in the future.
Hello everyone, my name is Amory. My student identification number is 2002511081, and today I'm going to present about our student project. So I will present about the program implementation part and the partners of this program. So this program will be conducted through online meetings at the end of the semester. The participants will be able to share their experience anonymously, and others could help interpret the experience that has just been taught. So each participant has a chance to be able to tell their own experience. The student's facilitator is also available, and their job is to lead the session. For the partners of this program, there's the medical students as the participants, there's the executive council of students as the provider of the Zoom meeting room, and the facilitator of the student discussion group. Their job is to lead the way during the sharing session of the program. That's all from me. Thank you.
My name is Irrene Carla, Audithia Pranadiningrum, with student identification number 2002-511075. I will explain about the estimated budget. This program will be conducted in the current student group discussion through online meetings. Therefore, no budget is required. Next, we estimate some difficulties for this program. Firstly, this program will be conducted online, hence, the situation will prevent the participants from catching and understanding each other's nonverbal cues, such as making eye contact, reading facial expressions, posture, and gestures. It is also hard to make sure that each person is listening to the speaker affectionately due to the possibility of an unstable internet connection. Secondly, in the student group discussion, the members are from several different cultural backgrounds. It won't be easy to reach the point of understanding and respecting each other's moral values. Thus, the expected level of empathy might not be reached equally to each participant. The solution for these issues is encouraging the participants to raise awareness and involve themselves more in the program beforehand. The awareness from the participants is needed because the impact of this program will benefit them in the future.
Hello, my name is Angelique Cynthia Caroline. My student ID number is 2002-511068. Now I would like to tell you about the conclusion of our student project. Empathy skills are a must-have skill for a healthcare practitioner. Therefore, empathy skills must be learned by healthcare practitioners, especially doctors, since they are still in the preclinical stage. From studies, turns out medical students who are highly empathetic are almost equal in percentage with medical students who are less empathetic. In order to emphasize the empathy skills of each medical students, we presented a program called For Compassio Verac, which develops in 4 stages of fire: Formido, Intima, Renew, and Explication. Hopefully, this program can help medical students to increase their empathy skills. And that brings us to the end of our student project presentation. We would like to apologize if there are any mistakes in this presentation, and we would like to thank you for your time and your attention. Thank you.